Have you noticed how a tiny pacifier can calm a big cry in seconds? Or how leaving the hospital can feel exciting and scary at the same time? Maybe you're also wondering if that first car ride home is really as complicated as people say. If these questions are on your mind, you're in exactly the right place today. In this video, we'll talk about pacifier use from day one, the decision to go home early, and how to set up a safe first car ride. We'll keep it simple, clear, and reassuring, so you can feel ready and confident. You'll learn when a pacifier helps, what to do if you prefer to wait, and how to spot early newborn concerns at home. And we'll end with step-by-step safety tips for the car seat, because safety starts the moment you leave the hospital. Babies are born with a strong need to suck, and that's totally normal. Using a pacifier for a short time in the hospital will not addict your baby. As long as your baby is getting full regular feeds, a pacifier can be a soothing tool between meals. There's even a bonus. Offering a pacifier during sleep may help protect against SIDS, which is one reason many parents introduce one early. If you're breastfeeding, you can still use a pacifier without guilt. There isn't strong agreement that pacifiers cause nipple confusion or block breastfeeding success for all babies. If your baby is feeding well and gaining as expected, a pacifier can simply be one more way to soothe. If feeds are still a little wobbly, you can hold off and focus on latching first. Then add the pacifier once feeding is steady. Your preferences matter, even in the nursery. If you'd rather your baby not use a pacifier yet, tell the staff kindly and clearly. Ask them to bring baby to you for feeds when crying starts, or to try other soothing methods after a feed. At home, if you decide your baby needs more between meal sucking, you can introduce a pacifier then. Hospital stays are shorter than they used to be, but safe discharge depends on a few key checks. Early discharge works best when your baby is full term, a healthy weight, feeding well, and you feel ready to care at home. It also helps if you can see a healthcare professional within 2 days after leaving the hospital. Talk with your doctor about your situation, and make a plan that fits your family's needs. Keep an eye on feeding wet diapers and energy. Call the doctor if your baby refuses to eat, shows signs of dehydration like fewer than 6 wet diapers in 24 hours, or has very dark yellow urine. Seek help for constant crying, unusually weak or no crying, fever, or red and purple dots on the skin. Watch for jaundice by pressing gently on the skin. If it blanches yellow instead of white, or the eyes look yellow, call your doctor for guidance. From the first ride home, your baby must be secured in a properly installed car seat. Rear-facing seats protect a baby's head, neck, and spine far better in a crash. Plan to keep your child rear-facing at least until age 2, or until they reach the seat's height or weight limit. Getting used to safe buckling from day one makes every later ride calmer and safer. Install the seat tightly when you push near the belt path. It shouldn't move more than an inch. Use the harness slots at or below your baby's shoulders for rear-facing, and position the chest clip at armpit level. Dress baby in regular clothes and place blankets on top after buckling, rather than using bulky snowsuits under the harness. Consider a certified technician to check your installation. A quick visit can bring huge peace of mind. Parenting starts with 1,000 little choices, and you're already making thoughtful ones. A pacifier can be helpful, but you're in charge of when and how to use it. Going home is a big step, and you're not alone. Your care team is only a call away. Strap in safely, take a deep breath, and enjoy the beautiful ride ahead with your new little person.